Hi guys, good evening, good evening, good evening. Can you all see me? Can you all hear me? All right, so yes. Good evening, guys. I am Dr. Sandeep, your surgery faculty. So this is our new venture that we have started. I mean, this has been a very, very long dream that I've been having about to start a residency program to give quality education for surgery residents, to give them the real surgical components and the passing of the learning that we had to the next generation. And that is why I'm very keen about starting this small platform called as RxTX. It is one of our dream project that we wanted to kickstart. It has been there for last 2 years. We've been working really hard. I know because of various other factors, we were not able to launch it before, but now here we are with the RxTX platform. Now, you might be wondering that what is it bringing about and what are you going to do on this RxDX platform? A couple of things that I'm really keen on telling you is that this platform is going to train residents for various aspects of surgery, right? One, it will tell you about how to approach your residency, how to use each individual year, like as a first year resident, what are your responsibilities? How can you make your life easier on a first year resident course? When you go to second year, and what are the things that you should do on a final year? What is your basic job? And at the same time, you should also know that when do you start reading standard textbooks? When do you start reading your clinical component? When do you start getting grip of your university exams, and then what is the ideal time to start for your NEET SS? There's also a very important debate that do you really need to go into NEET super speciality rather than calling a super speciality? Do you want to sub-specialize yourself? What is the career path? What is in recent trends? What are the new things which are happening in surgery? As a resident, how can you get maximum benefit out of it? What are the new upcoming branches? Everybody says it is getting saturated. We will make you understand what is the true meaning of the saturation is, and then we'll pick it from there that how best can we guide you for your career paths. Right. So this app or this platform predominantly is divided into various aspects. But before that, I would like to introduce you to my team. We've been putting a lot of hard work and efforts put together. So this is our current team. I'll just put you across. I'll show you or introduce you to the team as well. One second, guys. Okay. So as I told you, we are a team of doctors. So uh, I'll be leading the way. You'll have most of the lectures, which are going to be in the theory form, will be dealt by me. But we have two of our, I personally love them a lot. I know them personally. I've worked with them. I've worked under them also. So it gives me a great privilege to introduce you to Dr. Uma Shankar sir, who is going to be our surgical oncology specialist. Sir has done his UG from Osmania Medical College, PG from PGI Chandigarh, and MCH from Tata. Currently, robotic surgeon as well as a chief academic surgeon at Mahatma Gandhi Cancer Institute. All your surgical onco components and all the questions, queries, everything is going to be taken care by our Uma Shankar sir. I'll be taking care of the entire general surgery. Along with that, I'll take about a lot of thorax also. That's where my specialty lies. In terms of thoracic oncology, we talk about esophagus, lung cancers, and all that, and plus general surgery in toto. Then we have our Sai Krishna sir, who is our surgical gastroenterologist from JIPMER. There is an assistant professor at JIPMER, so he will be talking about in detail about all your questions and queries about your surgical gastroenterology. So this is our team, and I proudly announce you that we will be mentoring you through various components. So we have a small WhatsApp group also. The link is there on the WhatsApp in your YouTube chat also. Will share you at the end of the session as well. This WhatsApp group is actually a community building activity where we want all the residents to come and join, and we will have a lot of fruitful discussion. So there we post a lot of questions which are being asked in your NEET residency program. We update you about all the YouTube sessions that we do. So how is this entire session planned? I will just put you in the aspect. So what we have designed is, so I wanted to keep it to so that everybody can use it in a very useful manner. So we have the sessions which are going to be on the following components. So the first one that we have is a WhatsApp group. Now in this WhatsApp group, this group is going to cater about your daily questions. We will put daily questions, and obviously we'll just not leave you at the questions. Once a questions has been put, all the questions that are put in a week's time, we will have one YouTube session for discussion. So I will put one YouTube session for discussion of this questions at the end of the week. So this is going to be once a week, which is going to be available, accessible for everyone on YouTube for absolutely free. I want every resident who is targeting a NEET SS. You don't need to think about beyond any other source. We will create the ultimate source. The power of doing one question per day is one topic per day. And you're going to do 7 questions. That means 7 topics in a week's time. That means it roughly translates, if I put the entire 30 questions in a month, and on a scale, by the time you prepare, let's say you're going to go for November's INI, your NEET SS program, even if you do 30 questions per month, in next 3 to 4 months, we'll be able to finish a quota of 150 questions, which is going to be your previous year topics. We will make sure that your first attempt of your NEET SS will be the most fruitful one, even if you're not prepared to the core. You are a resident, have believe and trust in the process that you have learned, and add this as a firepower. On the we have daily questions, and apart from that, we'll also post a lot of interesting cases. We'll put a lot of interesting cases. What is good about the component, or our team, is all of us are actively practicing surgeons. We see a lot of patients on a daily basis. We know what is going to be interesting for a surgical resident standpoint. We'll collect those cases and we will present those interesting cases on our WhatsApp group, open for discussion as well as for you to question us. This WhatsApp group will also cater, or we want you to ask multiple questions. So this is also going to be taking care of Q&A. Now, what is a Q&A is, all that you have to do is take a question, take a snapshot or a screenshot, wherever you get it, or whichever question, put it on the WhatsApp group. We'll be proactive in answering. You can tag me, Uma sir or Sai sir, so that we'll be able to answer your questions, or any one of us are available. We will cater and answer those questions at the earliest possible. See, the current NEET SS program or the NEET SS exam is purely on the basis of Bayesian love and Sabiston. So in this WhatsApp group, we have another session which is going to be the Bayesian love as well as the Sabiston's based tables. So we will keep posting all the important tables which are going to be from the Bayesian love as well as from the Sabiston. So this is what we cater on the WhatsApp group. Now, our major source for you to reach out is going to be our YouTube sessions, which will be conducted on the RxTX platform. Now, in this YouTube session, what have you put? Now, we have put a lot of interesting things on YouTube session. Number one, we will do a lot of theory lectures. This will go into theory lectures. This is going to be useful for your university exams. This will going to be for your university exams. Now, all those people who are going to write the university exam, a lot of you know that I already do a session called as BLS, that is Bayesian Love Learned by Dr. Sandeep. There's 80 hours of videos available, which consist of entire Bayesian Love. I mean, we are in process of creating it, but then you can take that access if you want to see my videos on YouTube. But we'll also do specific videos which are going to be for residents, and that is going to be for university exams, right? Along with theory classes, we will do something called as the surgery masterclass. Now, what is it going to provide you? The surgery master class that we are going to do, it is going to be one surgery per week. It is going to be one surgery per week, right? So we have divided the entire components or the entire general surgery for residents of general surgery. to understand there are basic surgeries that you should know step by step. You should know what is the important step. You should know also the intraoperative complications. How do you manage those intraoperative complications? What are the postoperative complications? How do you manage it? How do they look? See, a lot of residents have been texting me, said that I'm not from, a central institute, or I'm not from a, institute where I get a lot of exposure, or you're not from an institute where you're getting a lot of hands-on. One thing that we can promise you is by the surgery masterclass, at least you will know all the surgery steps with their clinical manifestation, presentation, images, videos, so that you will be able to orient yourself, and will make sure that it reaches to you in the most rightful manner. Then another session that you're going to do is what we call it as the surgery update. Now, what the surgery update is, again, we will bring you one new interesting topic or one new interesting update that will be discussed on a YouTube, and this is also going to be one class per week. This is going to be one class per week. Now, if you see, very interestingly, I've written that I'm going to do a surgery masterclass, one surgery per week. For example, this week we are doing modified radical mastectomy. Now, when I'm planning for MRM, one lecture is not going to be enough. So what we're going to do is we're going to do a series of 2-3 lectures which are going to be on that surgery, so that now you get very well versed with it. So there'll be 2 or 3 lectures. So when I say lectures, there are around 2 to 3 lectures per week for surgery. One lecture will be there for surgery update. And as we are already doing another YouTube session for your MCQs also, so another YouTube session, we will do one more YT session. This is going to be for MCQ, and this is purely on the basis of NEET SS and the INI NEET SS program. So this will be targeting specifically for these set of students. So if you're somebody who are keen in writing a NEET SS exam, this is going to be your go-to source. So this is on the WhatsApp group and the YouTube session. Next comes the major offering that we have, that is going to be your RxDX surgery app. Now, in the RxDX surgery app, what are we going to give you? Now, you're going to get the Q Bank, which is exclusive for your NEET SS program. Along with the Q Bank, we have something called as Clinical Pearls. Now, in the Clinical Pearls, it is going to be a comparative data concised in a table, so that you can revise all the all the topics, or any topic that you want to go in a sequential manner. You can just pick that clinical pearl of that particular topic and you can revise it just across it. Along with Clinical Pearls, you will also have the notes. You have the solved university exam questions. You have the solved university exam papers. This will include both MS as well as DNB papers. You will have the video lectures. Now, this video lecture is purely based on the Bailey Love. It is on the Bailey Love and the Sebastian's textbook of surgery as well as Schwartz. So what we have done is we have analyzed and we have seen that in the NEET SS specifically, entire general surgery is asked from Bailey and Love. Entire GIT and hernia is asked for Sebastian, and your endocrine is from Schwartz. So our video lectures are going to take these 3 textbooks into consideration, and then we'll give you the entire video lecture on the same. And the most important, you have the TND, which is going to be your video lectures. You have the Q Bank, which I've already told, but there is a certain set of Q Bank which is called as the faculty curated or the faculty selected. Now, this faculty selected Q Bank will have the video explanation. This will have the video explanation. Now, you think, is this enough? No. Then we have case presentation. Now, this case presentation is going to be provided by one of the most senior surgeon that we have. I will reveal it in a little while because that is a very, very big name in our circle. So I've asked sir to requested him to come across and give us the clinical presentation, for all the cases that you're going to go and write in the exam. So it will be his way of presenting a case that is going to be absolutely important for you. Our banger is going to be, we call it as the surgery step by step. Now, the what is surgery step by step is that we are going to provide you, let's say I'm talking about an appendicectomy. In an appendicectomy, I will show you the entire video step by step of appendicectomy, skin to skin, in an open as well as lap. The same will be there for cholecystectomy, same will be there for gastric, bowel resections, you have gastrectomies, you have mastectomy, thyroidectomies, paratidectomy. So all the major surgeries that you usually see in your day-to-day residency program, we will make sure that all those surgeries will have a dissected surgery step by step component of it, right? And the last offering that we have in the app, now this is going to be very, very important. This is going to be the solved PY piece. So those who wants to access only the previous year topic video lectures, so I have solved PYT video lectures that we have done in our app. So these are the 10 offerings that we have put in the app, each individually curated for all of you, right? So this is what we have in total. We'll be sharing the link for you so that you can join it as soon as the WhatsApp. We're already active. If you look at the current WhatsApp group that we have more than, close to 300 residents have joined. We have launched it only a week, 5 days ago. We got a very overwhelming response when we launched the app also. Thank you so much for all the love and support. I just want you to come down to the WhatsApp group, interact with us, see what best we can offer you and you can offer us in terms of learning. Let's make this journey a very, very interesting one. If you have any questions, any queries, I'm live on the chat box. I'll be more than happy and more ecstatic. And I can't express the feeling that I have right now for this series and this session. If any questions, I would love to take them one by one. Any questions, guys? Please put it on the chat box. Is it ideal to start NEET SS prep from secondary MS? I want to do MCH Onco. And I was okay. Great. Uh, right. So ideally, when you talk about what is the right time to start preparing for your NEET SS, the right time to prepare your NEET SS is going to be from your final year. The second year should be given to your books. That is for your theory. Second year is the time where I actually recommend all my residents to start reading a standard textbook. So when I say standard textbook, it's better that you start off or finish off the Sabiston. That is going to be one book that I recommend to every single resident. Once you're done with the Sabiston, if you have the time and energy, you should invest a little bit on Shackelford's and Blumgard's few topics that I will recommend you to go and read down from there. Urology, yes, Campbell is the go-to book, but I know you don't have a lot of time. There are few topics that I wanted to go from Campbell, but one book that you should read for urology is Bailey and Love. It is given beautifully and enough for a resident to understand. For thorax, you have a combination. There is a Washington Manual of Surgery that is very good. You can go read it from there as well. For onco specifically, NCCN guidelines is single most important resource. And there are certain topics that we will bring it to you from Devita. I don't recommend you to go and sit and read Devita. MD Anderson for onco could be a good book as well. Okay. So these are the various resources. We'll start sharing the resources also in our WhatsApp group. You can access those resources, start reading, and then, as we run a YouTube series on that. One more YT series that we plan to run or start, like we're doing for BLS. So this, we call it as the that is BNS series. The BNS series that we have planned is the Bailey and Sabiston series. As we do currently only Bailey and Love Learn with Dr. Sandeep. We have planned a BNS series also where we'll talk about all the important topics from the Bailey and Sabiston and then discuss them on a YouTube on a weekly basis, right? So yeah, these are the resources that I would recommend, but ideally second year should be given to read and the final year is the one you start preparing for NEET SS. The last 3 months that you have is for your university exams. Okay? Can you please tell what is the probable schedule of video lectures and case presentation? Uh, yes, this is something I wanted to be absolutely clear about. Right now, if you take access to the app, These are the things which are available. You have the Q Bank right now, you have the clinical pearls, you have the notes, you have the solved university exam papers that are available. All these are being done. We will upload it on a weekly basis. So you will see the progress in the app. What we have decided is we have launched the app at a very, very, very affordable price right now. So whoever subscribes to the app in the current form of the app, no matter what we add or how much we add and how much ever the price goes on, your subscription will stay at the same cost as you take it for today. Uh, as a resident, if you plan to take it today, and you'll get it for a very discounted price or a very little price that we have offered it right now. Tomorrow, when by the time we end or add all these video lectures, it will become one heck of an app. But then this will be accessed at the same cost. But yes, it is not completed yet. It will take a little bit of more time. We're doing on a daily basis. It's one step at a time, right? One more thing, we'll be posting the schedule on the WhatsApp group about all the YouTube sessions that we are going to do. So make sure you get to the WhatsApp group at least so that we can interact it where and you're more informed. You can follow us on the Instagram channel also. It is by my name, that is Dr. Sandeep Seram Reddy. It is there on the surgery guy's name. So we have the entire channel. You can follow me on the surgery guy. This is the channel that we have on the Instagram. This is also there on the Telegram. But for the residents specifically, I would recommend you to join our WhatsApp group. The link for the WhatsApp group is provided in the YouTube chat. Just go access it from there and it would answer most of your questions. So whatever schedule that we are going to have of the YouTube session will be posted regularly on the WhatsApp so that you remain informed, right? Okay, any more questions? Anything that you want to ask? Or do you have any suggestions that, apart from what all we have decided to offer in our RxDX app, do you want us to add anything further or anything more? Do you think anything else would be more beneficial? Or if you want to put some suggestion where you think it is not it is not present in the current form of education that is available, where we can pitch in and try to help and contribute more. Any more questions? Anything that you want to ask? Thank you so much, Mayank. I mean, Bailey series is something that is very close to my heart. So I started off in the same form to educate every single medico who wants to learn about surgery. Then that hit us that RxDX is something that we really want to do for residents because the learning has at a different level. So what we'll do is it is the same type that we're going to do with BLS, but here we will notch it up with more of surgical videos, more of surgical discussion. It will be purely clinical, and this time it's going to be more fun as well. By the way, we have Billion Love series tonight at 10 o'clock. So don't miss that. We're already doing small intestine there. We have finished 2 lectures of small intestine. Today will be a third lecture. I'll be doing the congenital disorders starting with Meckel's diverticulum and jejunal atresia. So stay tuned for that as well. Right. So if you have any questions, any queries, you know where to reach us. We will provide you with a WhatsApp link. Make sure please join down there. And we also have the app available on the App Store as well as at the Google Play Store. Go download it. The app is called as the RxTX app. Go choose surgery residency there and just hit it. Right. So the app is your RxTX app. 2 or 3 sessions per day would be useful, sir. Maybe by the other doctors of the team too. It would be speed up the schedule. Abhishek, absolutely. I am not the only one who is going to take up the entire load. We have our beautiful mentors with us. So actually, tomorrow is the first session of Dr. Uma sir, who will be taking the surgical series. What that is why we're bringing at least 3 or 4 videos per week so that you remain hydrated. At the same time, the learning process continues to happen. How many days will it take to become fully functional? Whatever we have offered here, by the time I finish the entire product, we're looking at a timeline of 3 months. But the TND will finish first. By the end of next month, you will have all the solved previous year topics. Most of the surgery step-by-step videos will be there. Clinical case presentation should be there. and then you will have TND video lectures. The main video lectures are going to take a little bit of more time, but then 3 months is what we're looking at. But the question bank and the question set, because I want you to use this for your upgoing or upcoming NEET SS exam as one single best source. So my idea is to provide all that within the first month. Vibhuti, right now the notes are not there yet because the notes have to come along with the video lectures. We have the handwritten notes that I have, which will be uploading on the app. You can access it on a PDF format. We'll also put that on the WhatsApp group, so you can just go take it from there as well. Give us a little bit of time. You will find every single thing. Notes will be provided. Many last year DNB questions are missing. Mayank, I've taken that into consideration. I've asked the team to look into it because I've already provided them the entire Q bank. I'll get the report by the end of this week about what are the missing DNB papers that are there, and we'll upload that with the answers as well. Don't worry. Thank you so much for the feedback. The app doesn't have images in Pearls as well as MCQ explanation. Sir, would it be helpful, especially for the anatomy related questions? Abhishek, I've taken that into consideration. Yes, because the app has been launched only 2 or 3 days ago. There are certain glitches that we have with the images. We are trying to solve it by the end of this. Or by the end of the August, we will be able to put you a lot of images down there. Every question that is there will have our explanation. It is initially curated by us only, but we wanted to put it with a little bit of video explanation. So hence a little bit of delay, but we'll do that as well. Please include topics such as, yes. So recent advances, transplant, robotics, VATS, all the new endoluminal surgeries, endoluminal techniques, all your fiber optics that we have, that is endoscopies, colonoscopies, fiber optic bronchoscopy, all these are included as one resource material that will be given to you as well. Thank you so much, Kuromi girl. That was a very, very useful suggestion. We will do that. I mean, guys, you guys have been an absolute amazing support since I have started the group. I've interacted with you personally, for a lot of people. Thank you so much for giving that feedback. I want you to continue to give me those feedbacks, which will be constructive for us. And please, please, please do tell to your fellow residents and friends that we are doing work which is of quality, and please do ask them to come and explore us. Trust me, we will not disappoint. We will do in our best capability to train the surgery residents at our highest level possible. So, okay, so this is what we had the briefing from our end. This is officially our the uh, what we wanted to call it as the launch day for the surgery app. But RxDX is already, I think, 2 years old. Surgery in RxDX is the most recent addition, and I'm proud, glad, and top of the world just to announce that we are now going to do an amazing work for surgery. Thank you so much for all the love and support. Continue to show that same. We will share all the YouTube sessions that we are going to do and a lot of other components on the WhatsApp group. Please join us on our WhatsApp group. The link is there on the chat box, and we'll share it to you accordingly as well. Until then, see you guys on a regular basis. Please share questions. Please ask your queries. Please bug us with all the problems that you're facing. Let it be personal, private. Let it be about a patient. Let it be about a case. If you want to discuss about a case, we'll be the first one to jump onto it. We would love to get your mind on a case, how you guys are thinking, and how we as senior surgeons can guide you in making a decision or as a mentorship component. Okay. Sure. Ishan Gupta, we do not have a group for MBBS student yet. You can explore the MEDED part of it where you have the NEET program as well. Okay. So, thank you so much for joining, guys. Thank you again. I mean, like, amazing response. I'm short of words, right? Thank you so much. But this is our offering that we're going to do it, and we'll stick to the plan as we continue to do so. Yeah. So, great talking to you guys. Please keep posting your questions on our WhatsApp group. Continue to be having a support. Let's make this venture a very, 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 very interesting and a fruitful. Until then, thank you.